So we recommend using this kit for any animal that you find unconscious, any animal that's been in a house fire at all or exposed to any smoke on a scene, and any animal showing any kind of respiratory distress. So in animals we would see that as panting or open mouth breathing. In other animals, heavy breathing, maybe noise on inspiration and struggling to breathe, or the tongue lolling out the mouth. And they can be varying levels of consciousness with that. So any animal showing those signs or have been exposed to smoke inhalation really should be receiving oxygen as soon as possible on scene to improve the outcome for the animal. So if the animal is not very tolerant to the oxygen masks, or it might be becoming a little bit disorientated and a little bit aggressive towards personnel, we do strongly recommend protecting yourself against bites and injuries. So the Baskerville muzzles are nice and strong and they come in multiple sizes. So these are a kit that can easily be purchased to go along with your oxygen masks. They fit very easily, so they just slip over the animal's muzzle and then one simple strap to click the muzzle in place. Also, our oxygen masks then do go over the outside of these, or you can use flow-by quite neatly by just tucking that into the front of the cage there. Any animal that's showing aggression or is not tolerating you handling it will actually increase its oxygen supply by doing that. So we suggest not trying to persist any further, as that might actually cause further problem for the animal and might cause it further distress. So once we've retrieved the animal and got it into a safe air environment and somewhere safe for us to be working, we want to just think a little bit before we use the masks about what's going to be appropriate for this animal. So improving its airway to start with, so we suggest putting the animal into sternal recumbency where they're sat up like this on their chest. If they're unconscious, obviously the head might be slumped forwards, and to improve the opening of the airway, you can use something such as a rolled up towel just across the front here for the head to be supported on, so lifting and opening the airway. We then want to have a think about whether there's any trauma to the face or the jaw, and whether there's actually anything obstructing the mouth. If it is safe to do so, you might want to remove that, but otherwise leave that till further in. And just check that it's going to be safe to apply either a muzzle or the mask onto the face. If it is, then do go ahead and either muzzle a conscious patient or get the oxygen mask out and prepped and ready to go. So in an ideal world, the muzzle should fulfill the mask completely and should be as close to the oxygen supply as possible. So some animals require the seal, some do not. This dog here, you can see it's actually quite a tight fit, and he might find that quite uncomfortable if he's conscious. So you can easily remove the seal from the mask, and then that makes a far more comfortable fit for the animal. And we just want to get that as comfortable as possible. In smaller animals such as cats, or dogs which have a much smaller snout, so things like pugs, you might actually find the shallower masks a better fit with or without the seal. So once we've decided which mask fits our animal best, we're then going to set it up. So it comes with the nice oxygen pipes, so simple attachment on that end, and these fit any kind of standard oxygen tank that you might be carrying, and they fit the standard outlet there for you. So pop that on. We then recommend turning on the oxygen first before applying the mask to the animal's face. Animals have a much superior sense of smell to us, and they actually find the smell of the oxygen plus the pass of the flow by the face quite annoying. So sometimes it's better to turn the oxygen on first. So we recommend just setting it at 5 litres per minute flow. And once that's set, then it's just a case of applying the oxygen to the animal. If they're really not tolerating this, then you can consider either moving the animal to an oxygen-enriched environment, such as a cage, which you then cover in a towel or plastic, and then put the oxygen inside that. Or you could consider just a flow-by, so holding the mask near the animal's face, or removing the tube and just placing that near the animal if they find that more tolerant. Once we've got the animal comfortable and restrained, and we might have it now on our oxygen therapy, we recommend for at least 20 minutes as an initial oxygen dose for these animals. We might start thinking about other considerations. So is the animal's fur and coat heavily contaminated. The muzzles are very handy for this to stop them self-cleaning and ingesting any further chemicals. Equally, cats might be handily wrapped in a towel to stop them either escaping or on regaining consciousness, and also to stop self-cleaning afterwards. We should also give some consideration as to the temperature of the animal. So some animals might go into shock after the trauma they've just received, particularly if they've been in any water or if they've just received a trauma. So being aware that they might actually need a towel or a thermal blanket placing over them. But a lot of patients are often with stress tend to go the other way and have a very high temperature. So just being careful as to how many blankets we might be placing on these animals, and certainly monitoring them as the animal goes forward in time and is becoming more conscious, then actually the temperature might rise and we might need to remove that blanket to keep the animal comfortable. As this animal goes forwards and it's recovering, hopefully with the oxygen on board, you might find that as they regain consciousness or as time goes by and they start to feel better, they may become less tolerant of the oxygen therapy, and you may then wish to either remove the mask and use flow-by, or you can try initially turning the flow rate down from 5 to 2 litres per minute and seeing if that's enough to allow the animal to settle. Also, just being aware they may feel quite disorientated and scared, and just using nice calming voices or getting the owner nearby to help reassure that animal can help significantly improve the outcome for these animals.